Look, insurance sucks. I'll just make it suck less. I'm a health insurance hustler. Bradley Hannon's the name.
There are all kinds of different mistakes that I see both agents and consumers make when selecting a health plan for either themselves, their family, or maybe their client. And we're going to talk about the biggest mistake that I see both consumers and agents make. But before I do, I want to remind you, we're talking about the basics, right? This is back to the basics. We're getting ready to go into open enrollment. My goal for this series is to give you the knowledge to either make the best choice for yourself or make the best choice for your clients, and making sure that we get the best coverage to fit their needs. So talking about the number one, I'm telling you, the number one biggest mistake that I see people make, okay, when selecting a health plan is, you ready? Not customizing that solution to the situation. And what I mean by that is there is no one size fits all approach to health insurance. There really isn't. I tell my clients a lot of times, okay, maybe you're one of them. I tell my clients a lot of times that the ages where, your grandfather had the same plan for 30, 40 years, they just don't exist anymore, because what you're seeing happening, if you do that, if you're staying on the same plan year over year over year, that premium has probably gotten outrageous, right? The coverage has probably even changed since you first enrolled in that plan. And when our grandparents and our grandparents had insurance, it wasn't changing like it is today. We live in a very, very fast-paced world with all kinds of different changes, especially as it pertains to our healthcare system and our health insurance options in the country. So to not customize your plan or your benefits to fit your exact needs would just be a total waste. And so the days of talking to your neighbor, or maybe even I hate to say it, but even maybe somebody you work alongside of that makes a different income, right? Maybe you're in sales, maybe you're a real estate agent, okay, work with a ton of realtors. Here's a perfectly good example. Mary Jo, this realtor over here, she crushes it. She's making $250,000 a year. She's selling a bunch of properties. And she talks to Susie Q over here, okay? So Mary Jo's killing it. Susie Q, she's a new realtor. She's making $30,000, her first year, that would be her income. They both have a similar plan, but Susie's paying $20 for it. Meanwhile, Mary over here is paying $300. So she calls her agent and says, hey, what the heck is going on? I just talked to Susie. She also has a Blue Cross plan. We'll just throw that name out there. She also has this plan. Why is she paying so much less? Well, the plan is customized to Susie's situation. Susie's not making a whole lot of income. She qualifies for some extra help, and therefore her premium is different. So in order for you, and I hear all kinds of things about, let me talk to my accountant about this plan, let me talk to my doctor about this plan, let me talk to my friend about this plan, let me talk to my mother's uncle, sister's cousin about this plan. The best person to talk to about your plan is the broker, or many brokers. Hey, listen, if I give you some advice and you want to shop those options, by all means, I'm all for talking to somebody that's going to show you all of the options. But there is no stone left unturned when you work with me. We're going to look at all of your options to make sure we find you the best plan at the best price. But don't make that huge mistake in thinking that your situation is the same as somebody else's. You are unique, and your health insurance options should be too.